Good evening, Dr. Wyman.
Hello, good evening. Hi.
Hi, how are you?
Nice to see you again. I'm good.
Same here. So everything going up. We set up the YouTube channel, so everyone is waiting for you. But before I do introduce you to the audience, I need to make a few announcements. So ladies and gentlemen, please, for who ask about the certificates, they're gonna be attendance certificates at the end. So please feel free to put down your email address and your name, and then we're gonna send your certificate immediately to your email. We're gonna leave the questions and answer at the end. So after Dr. Wyman finishes the presentation, we're gonna open the floor for questions and answers. One more thing, please. The webinar is going to be in English, but after the webinar, the highlight of the lecture or the webinar will going to be translated by myself, and it's going to be circulated in the social media of all Al-Amal conferences and exhibitions. I rather prefer to keep everything you need and put it down in the chat at the end, and just try to use your time by listening carefully to Dr. Wyman. If there is anything, please, as I said, just leave it to the end. So just one more thing, please. I want to make sure that you have a clear lecture and the voice as well is clear. If someone just put it down in the chat so we can start immediately. So good evening, ladies and gentlemen. We are pleased to have Dr. Wyman Chan for the second part of the teeth whitening, which is going to take us to step-by-step teeth whitening, which is exactly what we need in the clinical practice. Dr. Wyman is a veteran for more than 20 years in the dental industry, and in particular, more in teeth whitening and bleaching. He has 14 UK and US patents. He's currently an associate professor in the School of Dentistry and Medicine in Birmingham in UK. All of us welcome Dr. Wyman for the second time, and the floor is yours, Dr. Wyman.
Oh, thank you very much, Dr. Awali. Okay, so for those people who wasn't with us last time, let me just I went through what we covered the last time. Now, in part one, we did introductions to teeth whitening, and we covered different ways of doing teeth whitening. We also look at the different type of stains on the teeth as well. And also we look at the indications and the contraindications of teeth whitening. Or we also look at the common problems associated with teeth whitening processes. I think very important last week, we also look at the basic science of teeth whitening processes. How did teeth whitening really work? What is in-office whitening and what is home whitening? But today we go really clinical. Last week was a lot of science, and today is all clinical and practical. Let's show you how I do teeth whitening in my clinic. So just do a little bit. I'm just trying to move my slides. It's not moving. Just give me a minute. I'm sorry about this. Let me see. Yeah, let me start over again. Okay, my slides have moved. I graduated from Guy's Hospital Dental School many years ago. And I did a PhD in teeth whitening, which is, I think is very appropriate. Efficacy and safety of teeth whitening processes, which I said last week, because I encountered a lot of problems with teeth whitening when I started doing teeth whitening about 30 years ago. So I'm very pleased that we discovered lots of things about teeth whitening that I'm going to share with you today. And I'm clinical associate professor, which is at College of Medicine and Dentistry, which is part of the BPP University in the United Kingdom. And I'm a dentist like you guys, but I do not do routine dentistry anymore. I hang up my drills 18 years ago. I just do teeth whitening all day long. That's what I do. And I spend a few days in the clinic every week, and then I spend the rest of my time doing research and development on teeth whitening processes, also on the products as well in the chemistry. And I'm a founder of Dr. Wyman Chen London, which is a very special place. We don't have any handpieces in a clinic, as you can see. We don't even have dental chairs and overhead lights. We just do teeth whitening and Botox. That's what I do. It's a dental facial aesthetic clinics. So in time like this pandemic, we don't have any aerosol. So I'm really glad that I took a decision 18 years ago to hang up the drills. So no more drill for me, just teeth whitening and needles for Botox injections. And this has been said before, I'm an inventor and an innovator, so I've got lots of patents. And I also train a lot of dentists as well. I train, in fact, over 10,000 dentists now worldwide. I do a lot of training in China at the moment. I go there every month to train dentists. I've done over 16,000 teeth whitening treatments. So I just do some disclosure. I'm a founder of Perfect Trays, which is a company that make bleaching trays for dentists. I'm the founder of Whiten International, which is a products company selling teeth whitening gel and teeth whitening devices, also to dentists all over the world. In my clinic, I use my own inventions. So at times I only mix up the gel when I want to use them. So they are all personal to me. And these are some of my inventions. These are the thermal diffusers. It's just like a kind of heater, but no lights. And then this is the special trays that I designed. I have 2 patents on the trays and now have a few more. And these are the products that some of my inventions. They have many different formulations. And this is the retractor, which are very soft and autoclavable, which is very special. So we patented it in China. It's very useful in teeth whitening and other anterior aesthetic treatment as well, cosmetic treatment as well. Okay, let's look at recap. What are the methods of teeth whitening or professional teeth whitening? We have the in-office bleaching. We have the home bleaching, which is or whitening combination. We did the home in-office first, and then followed by the home whitening. And also there are some dentists do home bleaching first, and then followed by in-office. So there are so many ways of doing teeth whitening. So at the end, I will show you which is my preferred method that I really like to do that method. Okay, before we do teeth whitening, we need to do consultation, assessment, like any dental treatment. So and then we go to tell the patient what type of teeth treatment we're going to do. Is that a home bleaching? Is that an in-office bleaching? Or is that a combination of both? And then we got to talk about the fees. Also, it's important to assess the patient's, I think the expectation, really important. If we manage that expectation well, then you're not going to have problems. If we do not manage the patient expectation well, then we always end up with a lot of problems. So really important. And after we are done our consultation, the assessment, and the patient want to go ahead with the treatment, then we start doing examination of the teeth and the gums, make sure that they are healthy. And then we start doing our treatment plan. So this is just like we're doing any other dental treatment. We've got to do it in stages. I know that we do not do dental teeth whitening like this, like we do a dental treatment, but we should treat that as a dental treatment. So let's look at this, the patient present with teeth, yellow teeth. So we're going to do treatment planning. We're going to ask the patient what they want, and then I'm going to go through this case with you later. I think treatment planning is really important, which at the moment, that's what we did not do. We don't do treatment planning when we prescribe a teeth whitening treatment to our patients. I think that is really important. We need to incorporate treatment planning into our system. Okay, so we're going to take a shade guide And then when I ask the patient what shade they want to go, they can take a shade, they can choose a shade. And before we do all that, we need to have the pre-treatment preparation. Consent form is really important. So we're going to make sure your patient sign the consent form before you start the treatment. The consent form is just like a contract. So if you do the contract, that means everything you want to write down, anything that can happen, put it all down in a consent form. And list out all the possible side effects. So anything that happen, for example, sensitivity, discomfort, wearing the trays when you're doing home bleaching, or when you're doing in-office bleaching with a retractor in the mouth for an hour, 2 hours, may not be comfortable. So list all these out in your consent form. And also sometimes you're not careful, you do in-office bleaching, you use a very high concentration of hydrogen peroxide, and you can burn the soft tissues, the gingival tissues, and it can also cause soft tissue ulceration as well. So we're going to put all this down in, just in case you make a mistake, all these things can happen. But put it all in, just so if you made a mistake, that means it is an accident, it's not intentional. Before we start, we're going to scan and polish for the teeth are nice and clean. I don't usually do that. Only if they have a lot of plaque on the teeth surfaces, then I just do a polishing. I don't even do a scalp. Just polish and remove, then mainly just remove the plaque. If you have any calculus on the teeth surfaces, obviously you're going to remove them because they will inhibit the diffusion, which we talked about at length last week. We will inhibit the diffusion of the gel into the teeth structure. So like any other dental treatment, we're going to have a new case file record. And then, as I say, we're going to manage the patient expectation. Of course, we're going to tell the patient how long the treatment is going to take for the expectation that they want. For example, they say I want from an A3 to a B1. Then you tell them how you're going to do it and how long you're going to take and how much it's going to cost you, cost the patient. And afterwards, we like to maintain that color forever. So maintenance is important as well. We're going to do shade taking. This is really important. It's part of the integral part of the teeth whitening. So we can do it subjectively or we can do it objectively. So what is subjective shade taking? Subjective shade taking, we're using a shade guide, and then we're using which is called a daylight shade taking machine, which is important because we need to have a constant set the daylight setting. Every time we look at the teeth, the setting got to be similar or even got to be the same. So the teeth color will be the same all the time. So it's really important to have a device, a daylight device, like that. So we can use other devices. These are all the devices I use. This is my headlights. Also can be used as a daylight shade taking device as well. So what is daylight shade taking the devices? These kind of devices, they are calibrated to emit light with a constant color temperature of 5,500 Kelvin. That means it's a natural light. When it's a sunny day with no clouds in the sky and midday, this is when we're talking about a color temperature. And this is really important to have a constant lighting, good lighting in your surgery, your clinic. And this is taking indoor. You can see the color, which is quite dark. And this is the same shade, shade guide, taking just a minute later outdoor with on a sunny day at noon. So you can see the color. This is so much brighter than the one which is indoor. So really important. If you take a shade before your treatment, for example, with no sunlight, and the teeth will look yellow and gray. And then after you finish, or for example, they put it opposite. If you do your treatment before with a lot of sunlight, and your teeth will look pretty bright. I mean, especially in UK in the winter, when it's dark in the afternoon and the sun sets, and you've got a big window, and when you look at the color of the teeth, they will look like that. So that means, in fact, the teeth actually gone darker because of the lighting. So it's really important to have good lighting in your clinic. And nowadays, apart from the 16 shade tag Vita, which is the standard shade guide that I use, they have a 3 more OM1, 2, and 3, which we call a Hollywood shade here, which is mostly a lot of veneers done OM3. This is what the Hollywood color. And B1, yeah, it's white. but a lot of my patients want to go a lot whiter than B1. So objective shade taking, we are using a spectral photometer. So this is something very useful in research. Really, I don't think there's much use in the daily clinical use, because all these are, firstly, they're expensive, and secondly, they are very difficult to learn. It's a steep learning curve. It takes at least 3 months to learn how to do this properly. And there are many systems available. Vita also do one called Vita Easyshade, and Olympus do a Crystaleye, and also the Spectroshade. There are a few more in the market, but these three are more popular. And with a spectral photometer, it's not only telling you the shade, it takes a photo as well. This is using the Olympus Crystaleye. Actually can map out all the color, and wonderfully actually can give you the distribution of the color as well. For example, the white patches here, we can know it's very white, it's OM1, and the rest is a lot darker. So all this can map out the color of the teeth. I think photographic record is really, really important. If you do not take photographs, you end up with a lot of troubles. Really, really important. The integral part of teeth whitening procedure. If you're doing a lot of cosmetic treatments, you take a photograph. So teeth whitening is a cosmetic treatment. It's an elective cosmetic treatment. So photograph is essential. If you don't take photograph, for example, here, the patient come in with quite yellow teeth, B3 at the canine. And then when you whiten the teeth, if you didn't take any photographs, the patient said, my teeth hasn't gone any whiter. And you have no proof that the teeth has gone whiter. So photographic record, in fact, is the tangible evidence that the teeth has become whiter. So this is really important to take before and after photographs. Also can show your patient how white your teeth has become. You can also take the aftershade, put a shade tag in here. For example, this is OM3, equivalent OM3 next to it. So the patient can see the teeth actually gone to OM3. Okay, now this is, that's what we're gonna do. That's what most the dentists enjoy. They don't enjoy the science, they enjoy the clinical part, step-by-step home whitening. Okay, for step-by-step, let's say home whitening first. It's very simple. We just take impression of the teeth using customized, and then to make the customized trays. I like to use alternate. And I think last week I said I like to use the lower trays as well, top and bottom. And after that, and just make sure the alternate impression is really well taken, because if you've got a bad alternate impression, you're going to have a bad models, you're going to have a bad trays, bad set of trays, bleaching trays, and then you will not have the result that you want. And after you've done the trays, you will record the patient, and then you need to fit the trays as well, make sure that it's fitting properly. And there's a lot of debate. What kind of trays shall we use? Shall we use the scallop trays with the reservoir, with a big reservoir, or this one with non-scallop and non-reservoir? So it's up to your choice. I think whatever works in your hand, just do it. If it works really well for you, why change? But if you want to try some new technique, this is my design. You're always welcome. It's really important to follow the manufacturer's instruction for the contact time, because if you do not follow the instruction, if it doesn't work, they say you did not follow our instructions. So really important. Whatever products you're going to use, what works for you, keep on to it and really always follow the instructions. Okay, now step by step in office bleaching. Home whitening is easy. What you have to do is just taking a set of impressions. Isolation. Okay, there are some system ask you to use gingival dam, which is to protect the soft tissue, especially in the UK and Europe, because the products use it only 6%. So a lot of companies say, why use protection dam if this concentration is so low? So it's up to you. So if you use high concentration, you must use protection dam. Otherwise, it causes a lot of damage to the gingival tissue and the oral soft tissue, as I showed you last week. Okay, so we have a retractor in place, and then we have the gauze also in place as well. The gauze, there's 4 pieces of gauze, and we have a piece of gauze at the back of the mouth as well. And then we put the dam on, and then usually I do it in two stages. I usually put it on the teeth surfaces first, at the gum margin, to the top and bottom. And after I've done that, then I join it together. So that this is important, that if you're using very high concentration, this is a foolproof method. You protect all the soft tissues you can see. So if any accident happen, no gel is going to get to the soft tissues. So anything you can see pink color, you got to block it away. This is really important. And after that, you're going to apply the gel, which is depending what system you use. If it's I usually use 1 to 2 millimeters. This is what most system ask you to do. Let's put on the teeth surfaces, and then it's up to you whether you want to use a bleaching of a device. A lot of companies do not use bleaching of the device or light. I use a heater. If you listen to last week, to enhance the diffusion of the gel inside the teeth surfaces, so give me a better result. So it also depends on the system you use. So just follow the manufacturer's instruction. That is really important. A lot of systems you do 3 cycles of 10 minutes, and some systems do 2 cycles of 20 minutes, and some cycles do 3 or 4 sessions of 15 minutes. So depending on the system that you use, just follow the instructions. And some people are using the bleaching device and some don't. So all the just follow whatever system you use. Let's look at the instruction and also ask the manufacturer as well how to use them if you're not sure. Does the bleaching lamp add value? Like that lamp so strong on here, does it add any value? So CIA in 2003 did a very interesting study, a split arch study, which is credible. I think if you compare one person to another person, because everybody's teeth are different. So I believe that if you're going to do a good study, it got to be split arch. So what they do, they have X system, and each system got 10 subjects, altogether 80 people. And then the paint gel on all the teeth, top and bottom. And then on one side, on the left side, they cover the gel with aluminum foil, so that when the light shine on it, the light can get to the gel. And then they just want to see how effective, whether there's any difference between the left and the right. And it showed that on the left and the right side, after they followed the instruction of the manufacturers and the companies, they found that the left and the right make no difference. So why even bother to use a bleaching lamp? So this is quite a lot of studies show that this is one of them. And let me show you some excellent results immediately after in-office bleaching using the isolation dam. So before, after the result is pretty good. And before, after is pretty good. Okay, what method do I like to do? I like to do a combination method. I like to do the in-office bleaching followed by the bleaching trace home whitening. This is my preferred method. I've done it many, many times. I've done so many different ways. So at the end, I tried different methods. At the end, I went back to this method, which I like best. Give me the best result. This is what the patient expects you to do. And patient is happy, I'm happy. So I'm using the isolation dam for the in-office. I like to use the dam so that any gel you accidentally leak to the gums, and this can prevent that, prevent the burning of the gums. Okay, let's look at the first case. Amy came to see me in 2010, 21 years old. She's quite happy with the straightness of the teeth, even though it's slightly uneven, only mild aligned. But she's mainly concerned about the color of her teeth, especially her canine teeth, which is B3. So she just wanted teeth whitening done. Okay, so what we did a treatment planning for her. So we use a Crystaleye, then we can confirm the color on the canine teeth B3, and then inside the centrals are a lot whiter, A1 and B2, which is very common. The canine is always darker. And then we take a shade guide out. In my clinic, if you want to recommend your patients, if you're not confident to get the results, we actually personalize the treatment. We ask the patient to choose a color. We just don't do teeth whitening. We ask the patient, like with Amy, you ask her how white you want your teeth to go to. So this is something I like you guys to be confident to do. The more you do, the more confident you're going to be. So Ammie say, I want OM3. So I put the OM3 next to the B3, and it's very white. Okay, in that case, I say you want to go to, and then the, because I always put it next to the darkest two, because darkest two, especially the canine, are more difficult to whiten. So I tell Ammie that you need 6 to 8 weeks for me to get you to OM3. And she agree with the price, and then we go straight ahead with the treatment. So, and then I record the patient 3 weeks later, and I was amazed that I was going to continue to do the treatment. But the patient say, I'm so happy now. All my teeth are so white. In fact, I actually gone whiter than what I promised Ammie. Just in 3 weeks, instead of 6 to 8 weeks. And the patient say, she's very happy. And then we stop the treatment and save the patient a lot of money. And happy patient. So from here to here, and then the digitally is gone 18 shades whiter. Amazing. 18 shades, just in 3 weeks. Well, this is a very interesting case. Kasha, a female, 40 years old, got 2 porcelain crowns. You can see that the gum condition is not that well. Maybe 15 years ago, the natural teeth gone darker, but the crowns, the porcelain hasn't changed color, which is typical. And the patient not happy with the overall color. Want the teeth to look similar color. So obviously we have a few treatment options. We can change the crown to match the current color, but that's not, the patient doesn't want that. The patient wants the teeth to go whiter. And the patient also thinking about changing the 2 porcelain crown as well, because they are metal crown, metal base crown. So this was actually referred by a colleague, by a dentist. And then we look at the color. The canine is not bad, A2, but the crowns were pretty white, OM3 already. So the patient wanted all the teeth to look the same. And then because of the gum condition there, the dentist actually advised her to have that replaced with a full porcelain crown. Okay, so what we did treatment planning again. This is really important. We asked the patient, how much you want to go? Obviously, the patient say, I want to go the same color as OM3. So we put A2 to OM3. The patient says she's quite happy with that, OM3. And we give the patient 6 to 8 weeks to achieve to the color that you want. The patient agree with the price and the time. And then we start our treatment. And then 6 weeks later, you see that was so much whiter than the rest of her natural teeth. And when we finished, even OM3 was so much darker. So in fact, that color was about 1M1 OM3, but it showed up OM3 on the spectrophotometer. And so the patient are quite happy with that. And she sent her back to her dentist, who referred her to me, and having these 2 crowns replaced. In fact, in 6 weeks, we actually gone whiter than with what we promised the patients. So the patients are very happy. And I want you to bring your attention. Can you see the gum condition here? We haven't done any treatment. Patient hasn't seen hygienist in that 6 weeks or have any gum treatment done. What I asked her is that just to brush that area, and she did. I think basically that her oral hygiene wasn't good enough, and she brushed and her floss. I just gave her a very simple oral hygiene instruction for 5 minutes. And basically, when her teeth are whiter, I noticed people brush their teeth longer. When you brush your teeth longer, you start flossing, and the gingival inflammation will disappear. So she's very happy with the gum condition, gum condition as well. This is a very interesting case. Robert came to me in 2010, 49 years old, and Robert is quite amazing. Was a lecturer in a university, but he hasn't been to a dentist for 10 years. So when he came in, a lot of these I couldn't see these, so covered by calculus. So I sent Robert to see my hygienist, have the top teeth. Only got the time to remove the top teeth because we just do the top teeth. And we found that there's a lot of, we call it internalization staining, which is staining from the bacteria has gone to the enamel. And I can see that, and that's all that area here. So what are the treatment options for Robert? So treatment options, we can do composite restoration, just taking all out, all this area. or you can do composite veneers because your teeth are not straight. You can offer that to Robert, or you can do porcelain veneers. But Robert doesn't want any of those. He's thinking about composite restoration. Then I haven't done this before, so I tell Robert, I say, I think I'm quite confident I can remove all these without a drill. Shall we try it? And Robert say, okay. And he was referred by a good friend of mine. In fact, it's my neighbor, referred by my neighbor. So I say, how about try non-invasive teeth whitening? See whether it will work. You got nothing to lose. If it doesn't work, then you always can have the composite filling done. So it's nothing to lose. So Robert was amazed. I said, are you serious? Can that work? I said, I don't know. Let's wait and see. So I asked Robert, treatment planning, how white you want the rest of the teeth to go? So Robert say, okay, I just want to go to B1. Most men, they are quite happy with B1. It's a woman wants 0 and 3. Okay, so I want a B1. So I say it would take you 6 to 8 weeks to get your teeth to B1. And 3 weeks later, when I saw Robert, I was amazed. This is all by bleaching. All those disappear, all by bleaching. We haven't got to B1 yet, but Robert said, I'm so happy. All these are gone. And then we also, the hygienist scale his lower teeth as well. I can see that. So I just so happy. And I say, we haven't finished yet. I'm going to make your teeth to B1. Robert said, no, I'm really happy. So went away, but he took a lot of gel with him. So he doesn't want to have in-office treatment because that costs money. So he just bought some more gel and then left. And then I came back 3 years later and for a review. And I was amazed. This is 3 years later. The teeth was still really white. 1M1, that means it's been continued chopping it up and hasn't come back. All this staining, initial caries lesion haven't come back. So if you encounter something like this now, you do not have to drill. Try teeth whitening. It will work. As long as it hasn't gone to the dentine, it will work. Okay, let's look at some difficult cases. MIH, molar incisor hypomineralization. In this case with the white spot lesions. This patient, Ruby, came to me in 2018. She was 24 years old. Not happy with the 2 white patches there. She was born with that. And when she remember, as soon as the teeth came out, she got these 2 big white patches at the front of, at the tip, at the incisal tip of her 2 front teeth. So what do we do with this? So we do the assessment and we find out what is troubling the patient, what the patient's concern. So the patient not happy with the color because she's been living with that. She doesn't like to smile because it showed that she got the teeth color different, funny. And then you're going to manage the patient expectation because that is really white. So we're going to ask the patient, how white do you want the rest of the teeth to go to? And we may not be able to do anything about that tooth, about that white patches. We may have to tone it down. So, and then we talk about treatment planning. Okay, the patient are quite happy. So they say, okay, I can make that white, but I can tone it and make it yellower and see how it goes. Okay, so what we did is that we tell the patient that there are 2 options we can do. We can whiten the teeth first to the color that you want, and then we can use composite. Just take a layer as a filling, a white filling, make it a darker filling than the white patches and to match to the new color. Patients say, yeah, that is good, but I say that is minimal invasive. Well, we can do that. But there's another better way. I think a lot of people are talking about it, which is called resin infiltration. That we can put some resin infiltration here. and we change the refractive index of these white patches and they will match the color of the whitened teeth. So she said that, oh, there's even a better method. There's non-invasive. Okay, so she accepted either one of the treatment. So we went ahead with the treatment planning. So I show her the color. That this is OM1 and how white do you want your teeth to go to? And then I show her the shade tag. And then she said that she's quite happy with OM3. Okay, with OM3, you see the OM1 is still quite a lot whiter than OM3, so we need to tone that down after we've done the OM3. So I tell the patient that it will take you, okay, we show the OM3 to the patient. Darkest tooth is the canine, the B3, and then the front teeth a bit whiter, A2. So the patient got happy with the changes from the B3 to OM3 and from A2 to OM3. So I tell the patient that would take 8 to 12 weeks for me to fix all this, including we're doing the restorative work here, or including that the resin infiltration. So the patient fine, I gave her the price, she accepted it. And then we went straight for the treatment. And 6 weeks later, we actually got to OM3. Let me show you this. So we confirmed that with a spectrophotometer, which is the rest of the colors OM3, but that is still whiter, is OM1. So we need to tone it down. So this is a very interesting case. So I started with a non-invasive method. I used resin infiltration. So what I did, acid etch, and then we used photos of manufactured instruction, and it came up really well after an hour and a half. Actually, I used 2 syringes. They're quite expensive. In UK, it's about £100 a syringe. I was quite happy. The patient was quite happy and left. But then 2 weeks later, the patient called me that they say the white patch is coming back. So, so I started reading up because I've done many cases. It works. In this case, it did not work. So then I started looking at a lot of literature. I also found that many cases it did not work. So the patient came back a month later for the treatment again. So I tell the patient, shall we do the resin infiltration again? She asked me one question. Is it going to work this time? I say, no guarantee. And she said it took too long. I say, but if you want to guarantee it's going to work, we have to do the resin restoration, which is using very, very soft, flowable white fillings, and then I can tone it down. The patient said, okay, let's do that. Because you already paid for the price. She doesn't want to have something that it did not work before. So I did that, and I did the bonding, and I was very happy with that. Now, you see, the resin infiltration took me 2 hours in total. That took me 15 minutes just to do it. So much faster. So what I did, I just shared my experience with you. I'm using 2 types of flowable. I use an A1 and I use an XL. So XL is usually very white. It's whiter than OM1. And then you mix the two together and you put it onto the area. When the colors match, it's just like curate. But you got to acid etch first and bond first and prime and bond first, and then you use a flowable. I found it's very useful. This will take you about 5 minutes to get the right color. If a color is too yellow, you put a bit more XL in. If a color is too white, you put a bit more A1 in, just like during a painting. It's really, really interesting. And the patient very happy from here to here, and a happy patient. Ruby is very happy with the treatment. Okay, now traumatized tooth. This is also a very interesting case as well. A sound tooth. I've just seen in an article I think a couple of years ago. A dentist published in the UK, one of the UK magazines, because this tooth is not refilled. The patient has an accident. Olivia came to me 10 years ago. When she was 18, and she told me that when she was 8. She bumped into the wall playing a game called What Time Is It, Mr. Wolf. And it was dinner time, she ran straight towards the wall, and she had an accident, and she bumped her face on the wall. But you only noticed that about 8 years later, the teeth started to get darker, not straight away. But in most cases, the teeth will turn gray. If they turn discolor slowly, the color is really nice. It's yellow, brown, it's not gray. And the tooth, you can see the pulp is still there. Yeah, we see, and use an electric pulp tester. It's still got a little bit of response. So the tooth is still vital. So what do you do? What do you do with the treatment options? So we can do a porcelain veneer on that too. But the patient says she wants her teeth to go whiter. So porcelain veneers, that means you're going to do the whole lot. Maybe too expensive. Let's concentrate on one tooth. What can we do? Offer the patients. Porcelain veneers, you can do porcelain crown on one tooth, or you can do internal bleaching, like the dentist who wrote the article, open a hole at the back here, do a root canal filling, and then put an internal bleaching inside, seal it, and which is a walking bleach, and the teeth will go white. So, but that is very invasive. We talk about taking the nerve out, which is a vital nerve, and then doing a big hole here, doing internal bleaching, and got a big palatal restoration or cavity. So I offer her, I say, how about this? How about non-invasive teeth whitening? This was the first case that I've done. In the past, most option would be internal bleaching or even a porcelain veneer. So I offer the patient, if we do non-invasive teeth whitening, we can whiten the whole teeth together, everything together. Instead of doing one tooth, we do it all together. And patients say, really, can you do that? I said, I don't know, never done it before. Let's see what happened. So, and the patient came back. So we look at the color, which is before, and then the canine is before, and all the canines before, but that tooth which is not traumatized is A1. That means we know the color of that tooth would have been A1 if she did not have an accident. Okay, so we did treatment planning. So I asked Olivia, how white do you want your teeth to go? Most ladies, they are really not shy. They would say, I like to go on OM3. So I show her the OM3 next to the before, a lot whiter, and even the front teeth, a lot whiter. To say, I like to go with OM3. Can you do it? I said, I don't know, because I've never done this before. But now if you ask me, I say, yes, I can do it. I've done it many times now. So treatment planning, 8 to 10 weeks. Then we can get you to the color that you want. So we started that. But 3 weeks later, I was amazed when she came back for a review appointment. You can see the color, amazing. Gone from B4 to OM3, and all the canine teeth to the B4 to OM3 in a short 3 weeks. Well, we say 8 to 10 weeks. Then we did it in such a short time. So the patient was so happy. So this is what we did. The patient was very happy. Got a picture, but I didn't put it up here. Fluorosis. I think last week, some of the my colleagues asked me, how about fluorosis? Okay, let's look at fluorosis. This is a typical fluorosis, moderate fluorosis, moderate to severe, I will call, because there are lots of white patches here, chalky, and a quite dark color here. It affected all the teeth as well. But it's no pit, it's no pitting here, so it's not very severe. Maybe a little bit of pitting here. Okay, Angel, 30 years old, a student from Hong Kong, came to my clinic with her boyfriend because she doesn't like the color of her teeth. She said that she's been teased all the time. Say, or when she was young, people, her schoolmates told her that, oh, you did not brush your teeth. But what a shame, she was born with this. I mean, even though she said her oral hygiene is very good, but people still think that she did not brush her teeth properly because of fluorosis. So what are the treatment options for fluorosis? I think traditionally, people do microabrasion. Microabrasion, we need to know what is microabrasion. Microabrasion is using strong acid, actually taking a layer of enamel. And why do the dentists do that? Because the darkest color of fluorosis only affect enamel. So the darkest color, the strongest color at the surface, and it only affect 1/3 of enamel. A third of enamel at the on the outer third. So if you take the enamel away, the more enamel you take away, this color will disappear and the teeth will become more even. And this is, but that means it's quite invasive. You're actually taking enamel away. So you got to explain to your patient, microabrasion, that means you're actually acid etching and actually chemically taking a layer of enamel away. Okay, so I explain that to the patient. Patient say no. That is invasive, and I couldn't guarantee the results. What we're going to do. And then I say we can do resin infiltration. I say resin infiltration, that means this color will not disappear. I can make your teeth darker. They will match this color. But this doesn't look good. That means my teeth will look a lot darker. So that is resin infiltration, which is the opposite of teeth or whitening. Because if you put resin in here, you fill in all this area, which is a more hypoplastic, and then it changes the refractive index of the enamel of the hydroxyapatite and make it to mimic the color of the rest of the teeth, of the surface of the teeth here, of the tooth or of the teeth here. So the teeth would look darker. So the patient say, no, that's not a good option. So then the third option, porcelain veneers. I say we can cut 6 veneers, we can have 10 veneers, but veneer we can only do the top jaw. I say her bottom teeth are not affected badly. We cannot do the bottom jaw because of veneer, because of occlusion. And she say that veneers, I need to cut a lot of teeth away. And she say that it's invasive. She hasn't got the money to do that. But say, how about my preferred option, non-invasive teeth whitening? She says she like that. And she say, how white can I go? Okay, we do treatment planning. How white can she go? And all the colors, A1, but that color is really dark. That is actually is A4, and the C color, the gray color, very difficult. The teeth very uneven. And she say that she wants us to go to B1. Because she's been living with this kind of teeth for so long, she doesn't want to go too white. Okay, in that case, fluorescent teeth are quite difficult. Normally, you got to give at least 6 weeks to get to a good color and make it even as well. So normally in these cases, it's 6 to 8 weeks. So we can give her the options. So she's happy with the price and everything. So we went ahead with the treatment. And 4 weeks later, when we reviewed the case, and she was so happy. She looked at all her teeth gone so white, the front teeth gone to OM3, and then even the canines gone to B1, all already exceeded her expectation. Well, what she want. But I wasn't happy because I told her that I can make the teeth even, more even, because then we have another 2 to 4 weeks. So give me another 4 weeks. I can make the teeth really nice and even. But the patient is so happy. Patient say, oh, I'm really happy. I don't want to spend any more money. So even though I'm not happy about what I've done, but as long as the patient is happy, you have to accept that. So I have to accept that, even though this is not ideal. I know I can make it a lot better. But I'd like to bring your attention. Can you see the remineralization of these white patches here? It's amazing. So actually can remineralize as well. And also make that tooth darker. It means the whole tooth look a lot more even now. Okay, the last case, tetracycline stained teeth. Very interesting case here. Does it work? Is that possible? Okay, we have a patient, Thomas, 39 years old from Poland, but work in London. And you can see that he has some restoration done here. In fact, he actually been to a dentist a week before he came to see me. Been to a dentist in Harley Street, which is the top place in the UK, in London, to see a dentist. This is traditionally is a top place, high end. So actually, he wanted to see a dentist because he's not happy with his tetracycline stained teeth for a long time. He's been living with this as long as he could remember. He's not happy, and it took him a long while. So he went to see a dentist, and I'm ready to have 10 veneers done. So this is quite severe, tetracycline stain. He's not too worried about the gaps here. He's just only worried about the tetracycline. That's why he's quite happy to have 10 veneers, 10 teeth cut to have veneers in. And the dentist actually make a shape for him that this is a shape we're going to make your teeth too. Did a wax up and all that. And then he went to a party that evening. He met a dentist in a party. And the dentist, we know that we dentists, when they go to a party, if you talk to someone, they know that you are a dentist, they ask you lots of dental problems because it's free consultation. I come across this so many times. So sometimes I don't say that I'm a dentist, I'm a businessman when I go to a party, even to avoid people asking you dental questions. So he talked to the dentist, say that, oh, I just been to a dentist in Harley Street. I'm going to have 10 veneers done. I got tetracycline stained teeth. And this dentist, I haven't got his name. Then I actually talked to Thomas. Before you have your teeth veneered, go to see Dr. Wyman Chan. Maybe he can have other options for you. So he was quite shocked. He said, okay, do you think that apart from veneers, there are maybe other options? He said, yes, go and see Dr. Chan. So he made an appointment to see me. And what are the treatment options traditionally? Yes, we have veneers like the dentist prescribed in Harley Street. We can do porcelain crown. I don't think veneers will look good because you need to cut at least 3/4 crown to make a veneer, 3/4 crown veneer. Then it will look good because the color is really dark. Or you can do a full porcelain crowns, to 10 crowns. Then you got lots of the tissue loss. You're going to cut a lot of teeth away. Or we can do non-invasive teeth whitening. So I tell the patient that, okay, you can do that, which your dentist offer you. I don't think that will work. Maybe a better option for you are porcelain crowns. And to make a color really nice and really natural looking. But I say, we can do the same with non-invasive, no drill, no cutting. And the patient was really shocked. He say, are you sure? I've been to so many dentists in my life, not here in America, everywhere. Everyone only offer me either veneers or crowns. He said, you're the first dentist who told me that teeth whitening work. And all the rest of the dentists told him that it doesn't work with teeth whitening. The options are veneers or crowns. So I tell Thomas, you've got nothing to lose. If it doesn't work, you always can go back to have veneers. At least your teeth will go a lot lighter. At least the patient, the dentist can do a very thin veneer for you if it doesn't work. So do the combination. You've got nothing to lose. So Thomas said, okay, I trust you. So we start doing treatment planning. We take a Crystaleye, we just confirm the color, what you got, C4, and then C4, and then B4, and also A4, all fours, very dark colors. And I asked Thomas, even though tetracycline, we'll ask the patient to choose. I said, what color do you want to go? Men are not too greedy. They say, how about B1? Okay, about this color. So we'll put it next to the B1 and the C4. So he said, oh, there's a big difference. Okay, fine. I said, this will take about 12 to 18 weeks to complete. No drills, just teeth whitening. You have to come back many times. Between 3 to 4 months, I think, I can get your teeth white. And the patient started doing that. We agreed with the price, baseline. And then see the patient 6 weeks later, it's already very, very close to B1. And then we continue. 12 weeks. All the teeth gone to OM3. The patient was shocked. He said, amazing. You not even make my teeth to B1, you make it to OM3, like a Hollywood color, show him Hollywood color. This is totally non-invasive, no drill. Probably you notice that I got a surgery next door. So we actually contour that and make it look a lot better. That is a bit thick. So I haven't changed that. So I don't think he needs 2 veneers on his teeth. He probably need to have this change, these 2 composite change, because I do not know how to do this kind of composite anymore. I haven't used my drills for so long now. And the patient really happy, Thomas. And we can do all this without the drill. Tetracycline stained teeth. And how about stability? This is a question a lot of dentists ask. How long is it going to last? I think it depends on the cases. Let me show you how long it's going to last. This patient came in before on the K9 teeth, and then when we finished the treatment, gone to 1M1, 1M1, OM3, and 2 years and 4 months later, no top up at all. I think the color is very stable, really, really stable. So it lasts 2 years and 4 months with no top up at all. If you do it properly, they do last a long time. And the teeth is still a lot whiter. There's 21 shades whiter, 19 shades whiter. This is in delta E. And this is another case, B3. When we finish the treatment, it's gone to 1M1 and then 1M1. And then the patient came back 3 years later, 3 years and 3 months later. Obviously, you can see the patient got a little knock here, so the teeth gonna be darker. But the rest of the teeth, I think they're very, very stable. Only the 2 front teeth got a knock. The teeth has gone slightly darker, so we can see that the secondary dentin is coming through here. So they do last a long time, 3 years and 3 months, no top up. And this is 6 years and 11 months. We saw the patient in 2011. I haven't seen the patient after that patient having a top up. Patient come back for a second treatment, and then we are to have a repeat treatment. And we took a Crystaleye that we are quite shocked. The teeth is still so much whiter than about nearly 7 years ago. So they do last a long time. This is 7 years, 10 months, nearly 8 years. Same thing. The patient came back for a repeat treatment, but the teeth are a lot whiter than when the patient left. And the teeth is still exchange whiter after nearly 8 years. So they do last a long time. And this is 8.5 years. So the patient came here, the teeth are B4 after we finished the treatment, gone to A1. And look at that, 8.5 years, no top up in between. The teeth maybe slightly darker. They do last a long time. At least the teeth hasn't gone back to that color. Hasn't gone back to that color. It's gone slightly darker. Okay, thank you for watching, and I'm ready for the questions.
Oh, thanks a lot for such rich webinar. It's a full of information, and I'm sure the
Hello.
audience have a great time. But before I do so, it seems there is still worries about the certificates. Just a couple of announcements, please. When it's come to certificate, please make sure you put down your name, your email address, and if you would like, you can put your phone number as well, and you can just put a private, so to myself as well, if you don't want to circulate your phone number. When it's come to English, there's going to be a translation by myself, and it's going to be circulated in the social media with the highlight of the importance aspects of this webinar, as well the last week webinar. And now all of us, with the great appreciation to Dr. Chan, will open the floor for the question. So please either to put your question down in the chat, or if you're listening through YouTube as well, there is a bar underneath it. Please feel free. It's your time to get the knowledge from the Bible, Dr. Wyman, in teeth whitening and bleaching.
Thank you, Dr. Ammie.
So here there is a question from Anita saying, how much concentration of carbamide peroxide we use in UK?
In UK, we are allowed up to 16% carbamide peroxide, which is equivalent to about 6%, just less than 6%. So we are allowed up to 6% in the UK. So 16.5% is the maximum, I would say. But most companies make a 16%. They don't have a 16.5.
We have another question as well saying, what about the issue of sensitivity when it's come to bleaching?
Sensitivity is all down to your experience and also your technique, your know-how. The knowledge is important. So if you do a lot of teeth whitening, you will find out some teeth are sensitive and some teeth are not. And also the products is one of the product you use also that dictates whether they are sensitive or not. Like I said in my last week, if you use very acidic products, you can cause some sensitivity in those exposed, because we have a lot of exposed dentine. Most of us got exposed dentine in our teeth. So if you go for the non-acidic gel, especially if you go for the high alkaline gel, and that will help you so much. Firstly, it will help so much, and then you still need to practice. The more you practice, the less sensitivity you're going to get. The more you're going to practice, one day you will get it painless.
Okay, I think you invented a pain-free teeth whitening. Am I right?
Yes, yes.
Okay, do you mind if you take us briefly in your technique and how does it help in managing the sensitivity, if there is any?
I teach this at the College of Medicine and Dentistry at the university, which is based in Birmingham, UK, which is part of BPP and linked to Ulster University. It's a 3-year course. You can learn. I mean, it's to do it non-sensitively and painlessly. It's very complex. I cannot say it just in maybe give you 1 hour. I still cannot say it. You have to do a lot of practice, and you got to understand the texture of the teeth as well. You got to understand what kind of teeth we're dealing with, because everybody got different kind of teeth. Some teeth are sensitive, some teeth are not sensitive. Depending, doesn't matter what you use, they are not sensitive. So these are the things that I teach in the university. Do not like to review. If you want to learn, you can come and enroll for the course, which is in Birmingham, UK.
Can you predict if the case is gonna be sensitive or not beforehand?
I can. If you're experienced enough, you can.
Okay, which main like criteria you based on your prediction in this case?
I teach this in the university again. As I say, maybe one day I will run seminar. I will do a webinar. I will think about it to share more knowledge with you guys. I'm really seriously thinking about it. I think maybe time for me to share. This is some of the secrets, some of my secrets.
Yeah, I know you are generous enough, and we highly grateful for that.
I will divulge so much.
Thanks a lot. Okay, we have another question saying, in a trauma case, there is no RCT done. We do internal bleaching for that. We need to do RCT first. I'm just reading the question as it is.
Yes, well, this is traditionally, this is what has been done. This is what I used to do 20 years ago. But 10 years ago, I tried this new method with Olivia, and it worked. Since it works with Olivia for 10 years, I haven't done internal bleaching for teeth, which are sound. I only do internal bleaching if they're root filled now. If they're not root filled, I will not do internal bleaching because I don't have to. You don't have to. If you know, if you can master the technique, you don't have to. Yes, traditionally, that's what we used to do, or that's what I think everyone's still doing, apart from me, maybe. I don't do that anymore.
Is it because it's more of conservative approach, I might say?
Exactly, this is non-invasive, totally non-invasive. If you do a root canal treatment, and then that means you're going to drill a big hole palatally. That means you're going to take a nerve out. That means you're going to put a root filling, and that is a lot of skill to do it properly. And then you got to do your internal bleaching properly. So that is a lot of work. For me, to using the trays is so simple. It's really simple. And it's non-invasive. I like to do things non-invasively.
Yes, this is definitely, I think it's work very well from dentist perspective as well from the patient perspective, which is take us to another issue, which is I saw it very popular in UK, but maybe to some extent is much more popular in the Middle East, where they use veneer more, but they haven't to try bleaching. But what I have seen through your cases, that bleaching gives a perfect and better result than veneer, and it still is non-invasive.
It is. From my experience, I've done a lot of teeth whitening. I think it's the knowledge, but it's also the practice as well. The more you do, the better you're going to get. You're going to be like anything else. The more you practice, the more you do, you're going to be good at it. And that's why I decided not to do any dentistry, just focus on teeth whitening.
Yeah, because I think that field in dentistry need a good person as you, where he has very understandable of the practical approach and how to maximize the result at the end.
Hopefully one day I will share.
Yeah, definitely.
Have a webinar. Yeah.
Looking forward.
And then show you how to do the cases, how to make them happen.
That's really good. We have another question. You know, when you show us the shade guide, and there is a Hollywood shade added up to the shade guide.
Is that a Vita shade guide I'm talking about? Yeah, Vita shade guide. Now, the old one, you have the 16 shade tag, which is from A, B, C, D. And now the new one, you have the 01, 1, 2, 3 add on to it. So it's become a 19 shade tags. So I think because in my clinic, B1 is yellow teeth. I haven't got many people asking for B1. Most of my patients asking for OM3 or whiter. I even got some asking for OM1. So B1 in my clinic, for to me, is yellow teeth. So hopefully one day you will all feel the same as well. B1 is yellow.
With the practice, most of likely.
Yeah.
Okay. And you know, when it's come to the teeth where they have a different shade within the same tooth. Now, we are not talking about the quadrant or the whole lots. How do you manage balancing and making up the shade at the end, which is the same?
Okay, this, do you remember the case on Olivia, the traumatized tooth at the upper right one, and then her canine teeth are also quite dark at B4. You do the whitening. I do the whitening all together, all at the same time. The darker teeth will whiten faster, and the whiter teeth will whiten slower. I haven't seen a case that they don't catch up. They will catch up. So don't worry, do it all together, they will catch up. You don't have to do the dark teeth first, and then come back and do the whiter one. Do it all together.
That's good. And you know, if I take you back to Cassia, one of your cases,
Yeah,
you just,
Cassia with the 2 crowns.
Yeah, with the crowns.
Yeah.
We come across like patient, whether they have a crown or they have composite filling, and that's make it very challenging. So do you start with like replacing the filling if it's not satisfactory, and how do you asks the patient, because this is going to add more of extra cost at the top of the bleaching. So how do you balance everything out?
See, for the crowns are easy, we just change the crowns. But with composite fillings at the front teeth, they are more difficult, because with a lot of composite fillings, depending who does the fillings in the first place, and see whether the whole tooth surface is covered. If a whole tooth surface is covered, that means you cannot bleach that tooth anymore. There's no way for diffusion. So that means the tooth will not go white. I think in cases like that, you have 2 options. You either can do veneer on those teeth, or you can remove the composite filling and all the way to the tooth. Not only to the tooth, sound tooth, you also have to take about 0.05 millimeters, about 50 microns in to remove the bonding. And then whiten the teeth all together, they will go white. And only when the patient's happy with the color, then you change the filling. Don't change the filling first. Fillings change at the last when you get the color.
Oh, okay. Yeah, that makes sense, I think. Okay, so when it's come to the patient, after bleaching, do you still give the patient the same instruction as we used to avoid any like staining food or a drink after having a bleaching?
If we do it properly, like in my clinic, I ask my patient that half an hour later, after they done the bleaching, or when they finish the bleaching, if you really like espresso, they can have a double espresso straight away. No restriction. If they like black tea, they have black tea. If in Europe they like red wine, they can drink red wine. No restriction on food. And if you like curry, you can have curry. No restriction. All my patients, I don't have any restriction. They can eat and drink anything they want.
So is it because of your technique and the material you are using?
It's not, but if you, I think, go a bit deeper, if you done your teeth whitening properly, you would have removed the color, the source of the color, which is in the dentine. For any food and drinks to go to the dentine, I would say it's impossible. So you only have surface stain. If you brush your teeth properly, you can remove the surface stain. Or otherwise, you can have a scan polish every 3 to 6 months, you can remove all those surface stains. So maintenance is important. That means having to see my hygienist regularly every 3 to 6 months to remove the surface stain. That's all it is. It's a surface stain, external stain. For the color to go, the tea and coffee and red wine and the currant and all those double espresso to go into the dentine is impossible.
Okay.
So the trick is to do the job properly in the first place.
Oh yeah, definitely. I don't know, maybe this question is beyond the webinar, but there is a question saying for composite veneer, we need to cut the tooth as well like porcelain veneer. She's asking.
I don't answer that. I don't know. I don't do that. So this is not teeth whitening.
Okay.
Maybe someone can answer that. I don't know how to answer that.
Fair enough, because this is purely is about teeth whitening, anything to do with teeth whitening. Another question saying, how long do you recommend home bleaching? How
long? It depends on the product you use. It depends on what system you use. So always follow your manufacturer's instruction. Every system works. Some works better than the others. They all work. Otherwise, they'll not be available. They'll be out of the market. They all work.
Okay, and you know, because nowadays the commercial, they are making a lot of money behind like promoting different products for bleaching. For example, toothpaste, and we come across the patient who are continuously asking about what is your recommendation, what is your point of view of using a simple like toothpaste. So what is your opinion about that?
In the UK, all the toothpaste, they do not have a bleaching effect. They do have a whitening effect. Whitening, it depends what you mean by whitening. Whitening, remove surface stain is also whitening. But toothpaste will not have a bleaching effect because the toothpaste will not get to the dentine, so it will not have a bleaching effect. It have a whitening effect. It can remove surface stain. If you do not brush your teeth properly, some toothpaste helps actually remove the surface stain.
There is a sort of like recommendation where they can go through the package itself and check in the concentration and the ingredient of the toothpaste before they can use it, just to avoid any side effect like sensitivity.
I think in Europe, all the toothpaste hasn't got peroxide. If you haven't got peroxide, there's no bleaching effect. So most of the whitening toothpaste, they do have some chemicals that can remove surface stain, and they do have, and some of them are quite abrasive as well. That's how they can remove surface stain and remove a little bit of enamel as well. So it's got to be careful that you do not buy a toothpaste that is too abrasive. But I don't recommend any teeth whitening toothpaste. Just the normal one, save your patient a lot of money.
Yeah, I totally agree with that. So, you know, when it's come to combining in-office bleaching and home bleaching, it should be administered by a clinician. Am I right?
I don't know. It depends on the law in the country. In the UK, yes, it has got to be done by a dentist in the UK, or a hygienist, or a therapist, or a clinical technicians. These four professionals can do teeth whitening. I don't know in other countries. I do not know.
Yeah, but I mean, is apart from the legislation or the rule of the country, is just about keeping a healthy teeth and to maximize the effect.
I don't know, but the hygienists can do it. The dental therapists can do it. The clinical technicians can do it in the UK. So they are not dentists, but they are dental professionals. So it depends on the country. And
they are well trained as well, because as far as I know, in here in the Middle East, hygienists, they don't do bleaching. They just do like a cleaning and polishing.
Then the law is different.
Yeah. Okay, we have another question, Mr. Chan, please. Saying, how long do you recommend home bleaching?
I don't recommend. It all depends on how white the patient go. That's why you got to do a treatment planning. It depending, because when my patient come to my clinic, I do not just give them something and take away and hope for the best. I guarantee the results when you come to my clinic. Actually, I tailor-make for everyone. You just come in and choose a color, Then I'm going to tell my patient how I'm going to get there, how much it's going to cost my patient, and how long it's going to take.
Thanks a lot. And one more question, please. With fluorosis and tetracycline, do you think the bleaching need more time if you compare it to other cases?
It all depends on you mean time. Yes, of course, because the fluorosis stains are difficult to remove, and tetracycline stains are also very difficult to remove. Like last week, remember I said that tetracycline stain take 1 to 12 months to get us to see a noticeable result. And in the beginning, I've said that fluorosis stain take at least 6 weeks to see a noticeable result. So it did take a lot longer.
You know, one of your cases you show us, it's you have like a review appointment after like a couple of years, and still the result is promising. So is there any recommendation for a recall period for your patient?
Most of my patients, they do top up once a year. That means top up, that means they don't come to see me. They ring up my clinic and they buy the products, and they most of them will have the bleaching trays. So they just we call it top up or maintenance. So I encourage my patient to maintain once a year. So every year, most of my patients, they buy a syringe, and some of them, they are very how we say, concerned about their smile, and some of them buy every 3 months.
Thanks a lot. There is another question saying, can we do internal bleaching immediately after doing RCT in a trauma case?
Yes, you can. As long as the RCT done properly, yes, you can.
And does that difference if it's like a recent trauma or old trauma, or is the same?
Trauma are different. I did not cover here, but I did cover when I lectured the four series of lecture for the College of Medicine and Dentistry. There are different type of trauma. One is very mild trauma, and then I mean mild damage, and others are quite severe. The mild trauma, usually the teeth, the color is yellow to brown, and the severe trauma, and they're usually gray, black color, because the reaction is different. Because you got lots of hydrogen iron sulfide, which give you that black color and reflect through your dentin and enamel. So if you got really like a severe trauma, the teeth usually appear gray. Probably we notice that as dentist. So they're different type, but the bleaching result will be slightly longer with a gray color. And on the yellow colors, I found that it's easier to bleach than gray.
Oh, okay. But how about if you have a necrotic tooth? Oh, sorry, sclerosed tooth. So there is no way you're gonna do RCT, but the color is different, especially if you compare it with the rest of the teeth. Can you do a bleaching, and is the result gonna be satisfied for the patient and for yourself?
You can do bleaching on any teeth that is a natural tooth. Anything that's natural, it works with bleaching.
Oh, thanks a lot. I think we covered nearly all of the questions. And do you like at the end to add anything?
No, I hope you guys enjoy this, and hopefully maybe one day I will do a proper training on webinar and just share more of my knowledge and the technique with you guys. So just watch the space.
Yeah, definitely. We're gonna arrange some that soon. Thanks a lot for your time, for your support, and this is coming from myself, from Al-Amal conferences and exhibition, and from all of the audience. It was very informative, full of knowledge and update. Thanks a lot. Thanks for
Thank you very much. Thank you, and see you guys soon. Bye.